Paula Nutting, your musculoskeletal specialist, and today we're addressing one part of the body that concerns many people at some stage throughout their lives, and that's one of a cranky knee. Whether you have osteoarthritis or age degeneration, many of us focus on the fact that the knee can become a problem and create pain in walking, sitting, standing, and everyday daily living movements. But I want us to think about something behind the knee, and in fact we're going to address some soft tissue muscle structures that might help your knee in the future. The two muscles that I'm talking about today are two muscles that aren't very commonly treated by the practitioner. They are the popliteus and the plantaris. Now, a popliteus muscle is a tiny little triangular muscle that sits in behind the knee, attaching at that lateral end of the thigh or femur and coming into the tibialis. And our plantaris starts in posteriorly and comes down and actually plants, hence the name plantaris, plants the foot and pulls down that big toe. We don't touch this area very often because it's classified as an endangerment site. But a therapist that is well practiced and understands the feeling of soft tissues and can feel the difference between a nerve, a blood vessel, and tendon and muscle can get some great results from doing this kind of work. You'll have many clients that come in and see you and they complain of knee pain, and it's especially prominent when they get up in the morning because they might have been sleeping in a side bent, knee bent position, and they complain about it going from sitting to standing, which is very common. Now, that's going to indicate to me as a therapist that I'm going to work at the back of the leg. We're going to start with the knee in flexion, and we're going to take the thumb as a therapist and we're going to find the big meaty bulky area of the popliteus, push our thumb into it and lock and myofascially take the thumb superiorly up the thigh while we take the knee from flexion to extension. So locking down and straightening the leg. Shortening it up again, finding the soft tissue of the popliteus, avoiding any neural structures, avoiding any blood vessels. You'll probably do this 5 or 6 times, and then you're going to reassess and see what their squat range is going to feel like. The majority of people that you treat will have better outcomes from squatting once you've completed that very simple, easy maneuver. Interestingly enough, you'll have clients to come see you that have got knee pain and very obvious knee problems. But sometimes you'll get someone to come and see you that has hip problems or ankle problems or lower back problems. And unless you get really good history and find out a little bit more about them, which might be some knee stiffness, especially in the morning, that you won't fix the hip, the ankle, the back, unless you check out what's going on with these two little muscles. I'm Paula Nutting, your musculoskeletal specialist.